indoor swimming pools won't be opening until December 1. They're classed the same way as brothels and nightclubs. Does that make sense? Why can't indoor pools open at 80%?
Well, that's based on the health advice, if Dr Chant wants to answer that question.
So obviously the roadmap is the roadmap, and there's a lot of detail that we will continue to flesh out about it. There are settings like indoor pools, but the behaviours and the things that happen in indoor pools are very different. If you've got a group of 12 to 15-year-olds that are swimming in a lap swimming in an indoor pool and they're fully vaccinated, then that's a very low risk situation. If you've got a situation where you've got lots of young children in an indoor setting, sharing change rooms in that setting, close contact, that's a risky setting because children are not vaccinated under 12 years of age. So if you look at the roadmap setting, and I suppose I apologise if this hasn't been drawn out a lot, what we're trying to do is keep as many unvaccinated people out of indoor settings. And so the reason that children are permitted to go in and sit with their parents is that the parents will be vaccinated and the children will be there. So again, there's less likelihood of the child amplifying the infection to the adults because the adults will be infected if they've picked it up, for instance, at school. And then the other context is that grouping is less likely to be having a large proportion of the proportion of the children or the proportion of people, if we limit it to 20, means that there's only at any one time going to be a small proportion of unvaccinated people in indoor environments. That's why we've removed those for outdoor environments. So what we are trying to do is a very cautionary opening and trying to remove the opportunity for people that unvaccinated people to be in higher risk settings, which is indoors. This is not perfect, and as we cast our eye over all the settings and all the different use cases, we will work through those issues. So I just ask the community to bear with us as we try and equilibrate, but that's the rationale behind some of those issues.
Can I just ask quickly too, while you're there, vaccinations, the federal authorities are telling us that they're finding that bookings are very rapidly decreasing. Are you still getting good, strong bookings, and are you still confident about that prediction of yours of 92%?
I'm actually going, I want to edge it up to 93%, and I think New South Wales can do it. So, sorry, keeping on being very greedy. Look, naturally we are seeing that when you do lots of first doses, you have to do second doses. So on average, we are still, though, getting around 40 to 50,000 people coming forward for the first dose every day. And so that, I genuinely believe that by next week, we will see 90% first dose. And the question for us as a community is how hard and how high can we go? And I want to see that first dose continue to increase. I particularly want to call out to the community to really ask your network, your social network, who hasn't been vaccinated, and if it is because they're finding it hard to get transport to a location, if they're finding it hard to navigate a booking system, if they've got a disability and are finding it hard to wait online, please help them get a booking. There is pharmacies where you can book for Moderna. GPs have an increasing supply of Pfizer and obviously AstraZeneca. Please help each other get vaccinated. I don't want to leave anyone behind as we get that target of 92%, because the question I'll always raise is when we get to that 92% and 93%, who is in that 7% that hasn't been vaccinated, and is it because they haven't had enough access? And I've got to say a big thank you to our services. Our districts have been doing pop-ups, working with community leaders, doing door knocking and very intensive vaccination in vulnerable settings. And I just want to acknowledge the work that pharmacists have put in, that GPs have put in, but also our local health districts who have been doing such important work in reaching our most vulnerable communities.